The new healthcare now available in Ticino for the treatment of cancer patients is unique and increasingly tailored to the needs of the patient. It is the oncological hyperthermia treatment that has demonstrated, in association with radiotherapy, an improvement in the local control of oncological diseases.
The project stems from the wish of the Ente Ospedaliero Cantonale to make available to patients a cutting-edge treatment with proven efficacy that until now was only available in 2 centres in Aarau and Geneva, Switzerland, geographically very distant. The need to strengthen EOC radiology and radiotherapy services by installing a new magnetic resonance machine led to a unique initiative. The project was technically complex in terms of implementation and now features the coexistence of hyperthermia and MRI machines in a single room protected by a Faraday cage.
Here at the San Giovanni Hospital, a very ambitious project, one of a kind in the world, is taking place with the installation in the radiotherapy room of an Alba 4 deep hyperthermia machine and a latest generation MRI machine, both used for diagnostic examinations and to radiotherapy planning. Next door in the adjacent room, a few meters away, is the True Beam Linear Accelerator for radiotherapy. The equipment is completed with a superficial hyperthermia machine, also in nearby premises, and a second superficial hyperthermia machine located in our second satellite centre at the Italian hospital in Lugano. This configuration allows a quick changeover from the radiotherapy session to hyperthermia as fundamental guarantee for the synergy and effectiveness of the 2 radiotherapy and hyperthermia treatments combined.
Breast radiotherapy is provided by a latest generation linear accelerator. It is a high-performance machine that enables treatment in just 2 minutes using modulated techniques for accurate target irradiation and optimal sparing of the surrounding organs at risk. This technology is also equipped with verification systems for continuous monitoring of the patient to ensure safety and reproducibility during all sessions of local hyperthermia, which is performed immediately after the radiotherapy on the newly treated target that is heated for about an hour at a temperature ranging between 41 and 43 degrees. The machine that performs this treatment consists of an antenna that delivers radio frequencies, ensuring heating to a depth of about 5 to 6 centimeters. The antenna arm is equipped with different types of replicators that vary according to the size of the area to be treated, on which a water bolus is placed that adapts to the patient's anatomy for optimal comfort. Moreover, 8 to 64 thermoelectric sensors are positioned between the applicator and the skin of the patient for continuous temperature monitoring. This setup thus guarantees high treatment precision and a very high thermal gradient achieved in just 6 minutes. We are also working with the leading European research centres on the development of radiohyperthermia for an increasingly personalised, accurate and effective treatment for the benefit of patients.
Thanks to hyperthermia that allows heating the tissues up to 41 to 43 degrees Celsius, the effect of radiotherapy and chemotherapy is enhanced by improving the oxygenation of the tumour, making it more sensitive to radiation and thus destroying the tumour cells. Magnetic resonance imaging allows us to assess the tumour's response to hyperthermia in real time.
Recommendations for hypothermia treatment are given after multidisciplinary discussion within the Swiss Hypothermia Oncology Network, where doctors from different cantons share cases of interest on a weekly basis. When we talk about hypothermia treatments, we have to distinguish between superficial hypothermia and deep hypothermia treatments. Superficial hypothermia is carried out in the case of recurrences of breast tumors in the head and neck area of the skin, such as melanomas, and in situations where the tumor-related symptoms, such as pain, do not resolve or improve with traditional treatments. Deep hypothermia treatments are recommended in combination with radiotherapy and possibly systemic treatments in locally advanced tumors of the pelvis, such as tumors of the bladder, rectum, anus, and uterus. Hypothermia is also recommended in inoperable pancreatic tumors and soft tissue sarcomas. In addition, there are national and international studies underway to evaluate the efficacy of this treatment on other tumor sites, which, if successful, will further expand the clinical indications. Hypothermia is a well-tolerated treatment with no toxicity. Some reddening of the skin in the region where the applicator is placed should be mentioned. The patient may report a sensation of heat in the treated area, which rarely leads to interruption of the hypothermia session.
We have chosen the Alba hypothermia system because it allows us, through a continuous and dynamic development of dedicated planning systems aligned to those already in use for radiotherapy, to reach very quickly the so-called fast hypothermia, with dose levels that, combined with radiotherapy, have proven to improve the effectiveness of cancer treatments.
Deep hypothermia therapy is delivered through the use of 4 antennas that generate independent phase-modulated electromagnetic beams in amplitude at 70 MHz, capable of focusing energy on the target anywhere in the abdomen, pelvis, and extremities. A customized plan is devised for each patient using software that interfaces CT and MRI imaging, allowing it to be visualized and controlled. In just 5 minutes, 41 degrees are reached in the treatment zone, delivering ultra-fast thermal radiation. Throughout the therapy, the patient's temperature is controlled using 64 dedicated sensors, and the system is equipped with a positioning laser for accurate and reproducible treatment. The machine uses a water ring surrounding the patient, both to transport the electromagnetic field and for ideal comfort throughout the therapy.
In addition to treating tumors for which the clinical results of hypothermia therapy are already known through various studies conducted in recent years at an international level, our fast thermoradiotherapy equipment will allow us to participate in ongoing research with the aim of increasing the oncological recommendations for which hypothermia is likely to prove effective. We would also like to extend the indication to other non-oncological fields in Ticino, where hypothermia has demonstrated its usefulness, for example, in the treatment of trauma, in orthopedics and sports medicine, allowing rapid rehabilitation.